Hi, my name is Dr. Henry Liang. I'm the medical director at Clarity Clinic of Las Vegas and Henderson. This video is designed to help you provide basic information about my treatments for mental health with ketamine. Let's talk a little bit about our consultation process. When you first come in, we'll review your general health, followed by your mental health history by me or one of my colleagues. This video will provide a brief overview of ketamine, so you're then prepped and ready to go for your infusions. We'll also give you some tips for successful infusions, recovery, and what to expect after the infusions. Now, as far as your pre-infusion instructions are concerned, we want you to make sure if you're taking lamotrigine or Lamictal, please hold your morning doses. You can take your evening doses as necessary, but don't take it in the morning of an infusion. Now, make sure to not eat or drink anything after midnight. That helps prevent any issues with nausea and vomiting. Unless we give you instructions otherwise, please adhere to those instructions every infusion. Make sure to bring a pair of sunglasses because you will become light sensitive after ketamine infusions, and it'll help with your travel back home. Sign up for the Osmind app. We'll send you a link through your email, and that will help you sign up for an app through your Android or iOS phone, and that will help track your depression and anxiety scores as well as your progress throughout the series of your infusions. If you are a female of childbearing age, make sure that you have enough urine for your first infusion to provide for a pregnancy test as well as future booster infusions. If you are breastfeeding, please make sure to pump and dispose of all breast milk for a period of 2 to 3 days after the infusions. We don't want any of the ketamine metabolites to transfer to your newborn. Now let's talk a little bit about ketamine. Ketamine has been around for a very long time, since the 1960s, originally developed as an anesthetic for humans, as opposed to veterinary medicine, as most people have mentioned with abuse. Now, ketamine, when it was first developed, was used on the battlefields of Vietnam. What they discovered was combatants receiving ketamine on the battlefield were coming back with lower incidences of PTSD, but that was anecdotal. And as soon as the war ended, people kind of forgot about it. It wasn't until the early 2000s that the first papers on ketamine's beneficial effects on treatment-resistant depression came out. And since then, there have been a slew of papers describing ketamine's beneficial effects for depression, anxiety, PTSD, bipolar disorder, chronic pain syndromes, drug and alcohol addiction, and abuse. Now, how does it work? Well, it does have an effect on increasing glutamate, or your excitatory neurotransmitter in your brain. But it also has an effect on neuroplasticity, which is remolding the neurons in your brain that have either been damaged or altered by the depressive process. There are many different routes of administration with ketamine. You can take it in lozenge form, intranasal sprays, intramuscular, and intravenous. They all have varying success rates. Typically, lozenge form gives you success rates at about 30 to 60%. Intranasal gives you success rates of about 18 to 60%. Intramuscular dosing gives you about 40 to 65%. IV low dose infusions give you about 65 to 75%, and escalating IV dosing gives you about 75 to 85%. We are currently hitting about 93-94% over the past 4 to 5 years now. Klarity was established in 2016 and was the first ketamine clinic in Nevada. We have extensive experience in treating mental health conditions with ketamine. Our protocol consists of 6 infusions over the course of 2 to 3 weeks. We adhere to an escalating dose IV protocol due to the highest chances of success. Our protocol success rates are amongst the highest in the country. once again, at about 94% for mental health conditions. Our patients also have about double the national average length of time between booster infusions, so you tend to need less booster infusions over time. We use sub-anesthetic doses of ketamine, or doses of ketamine below which would cause anesthesia in people. Now, as preparation for your ketamine infusions, we will check your depression and or anxiety scores through Osmind. For the initial series, answer the questions based on the period since your last infusion, so compress the scales. If your last infusion was 2 days ago, you'll need to compress the scale from none of the days, some of the days, most of the days, all of the days, to none of the hours, some of the hours, most of the hours, all of the hours, because we don't want to overlap with pre-treatment periods of time. The starting dose may depend on the history of psychedelic use. The typical infusion duration is about 40 minutes, but it may be lengthened to achieve more beneficial effect as necessary. We will check in on you a few times throughout the infusion. Why do we do this? Because we want to make sure that you're comfortable, you don't have any nausea, and we want to assess the delay in your response. The delay in your response will help guide us on where to take you dose-wise on your next infusion. Now let's talk a little bit about the ketamine effects at low dose and as you escalate. When you have ketamine at low dose, you will feel like you're light and floating, yet sunken down in your chair. As we start escalating the dose, you may start getting some color and shape distortion. You may see swirling patterns, digital patterns, colors that morph from grayscale into bright, vivid colors and back into grayscale. You may feel like you're floating in the sky, floating in space. You may see people or events from your past. And you may feel like you're completely surrounded 360 by these visions in your mind's eye. We will give you nice relaxing videos and music during the session itself. There will be some special lighting on the walls and ceiling. You will be monitored with your heart rate, blood pressure, and oxygen levels in real time, and that streams over to our computers, and we can keep an eye on you the whole time, just making sure that you're safe. Now, the common side effects and treatments of the side effects. The most common side effect of ketamine is nausea. Most patients don't get nauseated, but we give anti-nausea medications to all patients. If you do get nauseated, we have several other anti-nausea medications that we can combine to help get that nausea under control as best as possible. With a proper combination, the vast majority of our patients have their nausea completely under control. There are other side effects of high blood pressure and increased heart rate. Most of the time, we don't have to treat that. However, if we do, we have IV medication that will bring your heart rate and blood pressure back down to a safe level. Now, there are always risks with any infusion. Anytime we puncture the skin, introduce you to a substance that you never had before, there's always risk involved. That can include bleeding, infection, etc. However, ketamine has an extremely safe profile. Any patients, once again, we use it on babies and children in the ER and the OR to help set those fractures because it is so safe. Now, let's go on to the recovery after infusion. After the infusion's done, you'll come back. The psychedelic visions that ketamine will give you will go away within about 5 to 10 minutes after the infusion itself. We'll give you about 15 to 30 minutes to recover, after which we will discontinue your IV, and you'll be free to go. After the infusion itself, you'll feel like you'll have some weights on your feet. You'll be kind of wobbly, have slight dizziness, and you may have a little bit of a headache. That will usually go away within several hours after the infusion. We recommend that you go home, lay down, take a rest. You can eat and drink if you want, but just a little bit at a time so you don't get super nauseated. Expect to be at the clinic for about 2 hours for your first session and 75 to 90 minutes for subsequent sessions. Now, here are some tips for successful infusions. Let the medicine take you where it takes you. Don't fight it. Don't swim against the current. Get explorative with what the medicine is trying to show you. Dive deeper into it, and instead of trying to be standoffish with what the medicine is trying to show you, engage with it. Remember, when the infusion is done, you'll typically return to reality within about 5 to 15 minutes. Set your intentions. With intentions, you bring to each infusion probably 1 or 2 intentions on what you're trying to achieve. It can be simple things such as, I want to have better relations with my friends or family, I want to have a more positive outlook on life, I want to be more motivated to do things. Whatever it is, keep it simple. Focus on just 1 or 2 intentions throughout your infusion. With the lower doses, you can focus on those intentions throughout the entire infusion. However, when you get to the higher doses and we're having more of those psychedelic type visions, it may be difficult to focus on those. So when you're first starting and your blood levels of ketamine are starting to climb, you focus on your intentions then. Then you'll kind of peak during the middle phase of the infusion. Then you can just explore the infusion and what it's trying to show you. Then when the infusion's done and you're starting to come down, revisit those intentions. What it tends to do is to help reset and implant those positive thoughts and mindsets in your mind, and that will grow over time. Now, with regards to electronic devices, we ask that you turn your phone off and we'll set it aside. We don't want you on your phone throughout the infusion. We want you to reflect internally during the process and not have external devices interrupting the experience. Make sure when you are going through the infusion to fix your eyes on either the screen or one spot on the ceiling. Alternatively, you can close your eyes or use eye shades, which we have available. Looking around throughout the room will almost invariably cause nausea in patients. So we don't want you to get nauseated, so just keep your eyes fixated on one spot. Now, some patients, not the majority, just a few, maybe 10-15% of patients develop anxiety during the infusion. We want to make sure that you have some techniques to use during the infusion to help with managing that anxiety. Number 1, you want to do nice, slow, managed breathing. Also, you can use a technique called box breathing that helps to calm anxiety down. How to perform box breathing is you inhale over a course of 4 seconds, hold for 4 seconds, exhale over the course of 4 seconds, hold for 4 seconds, and repeat that pattern. That helps exceptionally well with keeping your anxiety levels down. We can also come into the room and talk to you and help manage your anxiety by talking to you. But if necessary, we do have an anti-anxiety medication, a short-acting benzodiazepine called Versed, that we can use. We don't use it on everybody because it does decrease your success rates. However, we won't hesitate to use it if you are really anxious. We want to make sure that you're calm and comfortable throughout the process. Now, after the infusion, for the remainder of the day, you may have those symptoms, once again, of dizziness, heaviness of your legs, head fullness, light sensitivity, and possible headache. For those patients with a history of migraines, it may worsen your migraines temporarily, but ultimately it tends to improve migraine symptoms by decreasing your frequency and severity over time. Make sure to hydrate aggressively afterwards once the dizziness goes away so you don't throw it up. But in the subsequent days, make sure you hydrate aggressively to flush out all the metabolites. No heavy lifting, driving, or legal decisions during the day of your infusion. Let's talk a little bit about ketamine-assisted psychotherapy, or CAP. CAP is an optional program whereby a certified psychotherapist conducts a therapy session with you while you are under the influence of ketamine. CAP is usually conducted about a week or 2 after the process, once your mental health symptoms are starting to subside. CAP helps to unlock the process of dealing with traumas, depression, anxiety, and helps to encourage longer acting benefit from the ketamine itself. Please let us know ahead of time if you're interested in CAP so we can initiate engagement with our psychotherapists to prepare you for your arrival. Let's talk a little bit about NAD tablets. With your first infusion, you will be receiving a bottle of NAD Plus tablets. NAD Plus is a coenzyme that helps with cellular energy production efficiency. It activates your body's own anti-inflammatory and DNA repair pathways. It really is quite helpful for our patients to extend the duration of effect between infusions. Let it dissolve under your tongue over 5 to 10 minutes. Take one tab first thing in the morning and mid-afternoon. Try not to take it after about 5 or 6 p.m. because it does produce energy and it can keep you up at night. Don't chew and swallow it as it deactivates in the stomach. For some final thoughts, we are very happy to have you coming to our clinic. We'll be happy to answer any questions or concerns by phone or in person. We look forward to seeing you in the office. See you soon.